is National Stroke Awareness Month.
And all month long, Franciscan wants to educate the public on warning signs of the disease. News 18's Isabella Caruso spoke with health officials about the symptoms you should look out for. Good morning, Isabella.
Good morning, Sam and Trevor. I sat down with a registered nurse here at Franciscan, and she spoke with me all about the warning signs of stroke that people often ignore. And she actually knows a lot about those symptoms because she experienced them herself.
I actually had worked that day, had a normal evening with my kids and my husband, and we were looking at my phone, looking at pictures, and I lost the vision in my right eye. Like somebody took a light switch and shut my right eye off.
Liz Mattingly isn't used to being a patient.
I was in a lot of denial. I just said I was having a headache, and actually it took like the third time of my husband saying, okay, what are we doing? We're either calling 911 or I'm driving you to the hospital.
But on that night, the roles were reversed.
We're probably the last people that will go to the doctor.
Mattingly had a stroke. Her husband rushed her to Franciscan, coincidentally where she has worked as a nurse for the last 20 years.
It could have been definitely a different outcome for me.
The key with stroke is that it happens suddenly.
And just 12 hours later,
I ended up stroking again.
She had to go into emergency surgery on her brain.
I didn't think it would ever happen to me, and that's the big thing, is being 44, you never expect a stroke.
Katie Young says a common misconception is that stroke is just a disease of the elderly.
People of any age can have a stroke. Babies can have strokes, kids can have strokes, teenagers can have strokes, people in any decade of life can have a stroke.
Stroke is also the #1 cause of disabilities in adults. Thankfully, there are ways to look out for it.
The acronym FAST, F-A-S-T, facial droop, arm weakness, and slurred speech. And then the T would be time, because time is of the essence when we're talking about stroke.
So if you or someone you know is experiencing any of these symptoms in a sudden manner,
they need to call 911. There are different things that we could do to treat people who are having a stroke. However, they're all time dependent.
Young says you should never underestimate your symptoms.
It's okay to overreact to stroke.
Mattingly glad she did.
I think I'm more in tune with my body now, and also in taking care of patients. I mean, I've been at Franciscan for 20 years, and I've taken care of multiple stroke patients, but I don't think I look at them the way I look at them now.
Sometimes the turning of the tables can give us a greater view on life.
I don't want to say I'm lucky. I want to say more or less that I'm blessed.
If you or a loved one has suffered a stroke, you're not alone. You can head to our website, WLFI.com, to find a stroke support group near you. Reporting live at Franciscan Health in Lafayette, Isabella Caruso for News 18.